So first I'm going to check the physician's orders, and I'm going to see that I'm doing an IV mini bag, and I am doing Rosefin, adding it to the normal saline, and I've checked to make sure that they're compatible, and I'm doing 1 gram of Rosefin once a day to infuse over 1 hour because the patient has a UTI, so I'm going to administer this antibiotic. And I see the side effects are shortness of breath, black and tarry stool, and unusual bleeding or bruising, so I'm going to watch for that the whole time that the patient is having this infused. And I'm going to verify that I have Rosefin, and it is 1 gram. It's actually 500 milligrams per milliliter, so I'm going to give 2 milliliters, and it's not expired. I'm giving it every 24 hours, so once a day, over 1 hour. And I'm checking lab values. I see that there's increased white blood cell, which is indicating that there is an infection, so that's why I'm giving an antibiotic. And I'm going to do the math really quick, that I have 100 milliliters of solution that I'm adding it to. I'm getting over 1 hour, so 60 minutes, drop factor's 10, so it's going to be 17 drops per minute. So now I'm going to wash my hands, and I'm going to draw up 2 milliliters of the medication. Alright, went everywhere. Going to change my needle, and now I'm going to administer it to the bag. Now I'm going to label that I administered the medicine. I'm going to label that I added Rosefin 1 gram, and my name, the date and the time, the patient's name, and I'm going to add it to the bag. I'm also going to label my tubing, and it's going to be whatever the hospital requires, how long that the tubing can stay on there, whether it's 2 or 3 days. And I'm going to label it with the date, the time, and my initials. And I'm going to make sure that this is closed. Technically this wouldn't be connected. And I'm going to make sure this is closed. I'm going to spike the bag, fill this halfway, and then I'm going to attach the alligator clamp. And now I am ready to go to the patient's room. So now I'm taking my MAR and everything to the patient's room, knock on the door, walk in, wash my hands, and tell the patient, my name's Jessica, and I'm here to administer Rosefin through your IV, which is an antibiotic. Can I get your name and date of birth? Check against the armband. Perfect. And I'm going to apply gloves. I'm going to check the IV site to make sure that there's no phlebitis or infiltration, no redness, swelling, there's nothing leaking, so everything looks good. I'm going to hang the medicine. Make sure my labels are still attached. I'm going to prime the tubing. Alright, make sure we don't let too much out, and make sure it's not all tangled up. Alright, so hang that until it's ready. Now I'm going to start the ASASH method. I'm going to start with the A, which is aspirating. I'm going to add a needleless device. I'm going to clean the site, or clean the port, and then put that in there. Open. I'm going to aspirate for blood return. Now I'm going to do normal saline. I'm going to do 1/2 milliliter, stop, do another 1/2 milliliter, stop, another 1/2 milliliter, stop, another half, stop, another half, stop, and another half until you get to 3 milliliters. Now I'm going to make sure I reclamp and disconnect, and I would discard of that, and now I'm going to connect the tubing, and I would clean it again and connect. Now I'm going to open this. I'm going to open this, and I would unroll and count the drops per minute, which I calculated were 17 drops per minute. So I need to calculate. And that's too fast, so I'm going to slow it down a little bit. Okay, so it's going now. And then I would take off my gloves. I would look at the site and make sure that there's nothing leaking out. I'm going to ask the patient if they're feeling any pain, make sure there's no redness or swelling, and I would take all my stuff, leave the room, and I would make sure that to come back every 10 or 15 minutes, check on the patient, make sure there's nothing wrong with the site. And now I'm going to come back and the bag's empty, so I'm going to wash my hands and reapply gloves. I'm going to close the clamp, disconnect. I'm going to have my saline ready. This is a new saline. So I'm going to have that ready to flush the site. I'm going to make sure that I clamp it. Make sure I reclamp that. Disconnect this. I would actually change the alligator clamp for the next administration, pretending it's a new one, and hang it so it's ready for the next person. I'm going to clean the site, have my flush, and I would do I would unclamp, do half a milliliter, good, half, another half, and I would do that just as I did before until I get to 3 milliliters, and I would actually reclamp that before I take it off and discard of that. And the H of the ACE method, I would administer heparin if the doctor ordered it, but this time the doctor did not order. So now I'm cleaning up my site. I am looking to make sure that reclamped, making sure that the patient does not have any phlebitis or infiltration still, that there's no swelling or there's no redness, pain, nothing's leaking, everything looks good. So I'm going to now document the med I administered, which was Rosefin, the dose and the route, the date, the time, and IV site, that there was no swelling, no redness or pain, and I'm going to record that I had 100 milliliters in the input and output. And that will be it.